Good afternoon, everyone. I'm Dr. Rajendran Dinesh Kumar. It's a pleasure to be a part of the 7th EN Train hybrid workshop and to share the insights on the evolving topic in ENT and head and neck surgeries. I'm here to present an instructional course on platelet-rich plasma and platelet-rich fibrin in ENT and head and neck surgeries. Over the next 40 minutes, I will take you through the key principles, applications, and the emerging trends of platelet-rich plasma and platelet-rich fibrin in our field. This presentation is designed in such a way that it is informative and clinically relevant, and you will be able to practice the applications of PRP and PRF in ENT after my presentation. My topic is on the application of autologous platelet-rich fibrin and plasma in ENT and head and neck surgery. I'm Dr. Rajendran Dinesh Kumar, Associate Professor, Department of ENT, Rajeshwari Medical College, Bangalore, and also consultant at Trustwell ENT Hospitals at Bangalore. So to begin with, platelet-rich fibrin, the development of this bioactive surgical additive is one of the great challenges of clinical research, and it helps in regulating the inflammation and increases the speed of healing process. Autologous platelet-rich fibrin is considered to be a healing biomaterial. Chocrons and his associates used platelet-rich fibrin in oromaxillofacial surgeries to improve the bone healing in implant dentistry. Dr. Joseph Chokron, platelet plays a crucial role not only in hemostasis but also in the wound healing process. In 1974, platelets' regenerative potential was first introduced by Ross et al., and the growth factors of these platelets were highlighted there. A variety of growth factors are released from the platelet-rich plasma and also the fibrins. The platelet-derived growth factor, the fibroblast growth factor, the epithelial-derived growth factor, the vascular endothelial-derived growth factor, and the transforming growth factor beta. So we incorporate the use of autologous platelet-rich fibrin and plasma. So it uses the patient's own blood. So apart from the already available description, which was mentioned in the previous slides, the platelet-derived growth factor, transforming growth factor beta, insulin-like growth factor, fibroblast-like growth factors, and epidermal growth factors, and vascular endothelial growth factors, interleukin 12, are also available and present in these platelet-rich fibrin and plasma. And what it helps leads to significantly from these parameters with all these growth factors in it significantly suppresses the inflammation by promoting secretion of leukotrienes A4. So how do we obtain this platelet-rich plasma and fibrin? In a plain tube without any anticoagulant, the blood is drawn from the venous blood is drawn from the patient, and it is put into the centrifuge and centrifuged at 3000 RPM for at least 7 to 10 minutes. There's a concept of soft spin and there's a concept of hard spin depending on the type of platelet-rich plasma and the platelet-rich fibrin you want to obtain. From there, you obtain, after the first centrifuge, an acellular plasma, which is the topmost layer, and you have the fibrin clot, that is the platelet-rich fibrin, that is the middlemost layer, and below we have the RBCs. Here in this image, you can see that this is the snot clot, and we can transect and cut the part below, which will have the RBCs, which is not of our interest. The mechanism, here the fibrinogen concentrated upper part combines with the circulating thrombin. Due to centrifuge, it forms the fibrin. The fibrin clot or the snot clot, the part between the RBCs at the bottom and the acellular plasma at the top. This middle part is the platelet trapped, which is formed in a mesh. And the success of this technique is from the time of obtaining the specimen and the collection of the blood and transfer to the centrifuge in less time, otherwise it will lead to activation of the clotting mechanisms. So here this video demonstrates how to obtain an autologous platelet-rich fibrin and platelet-rich plasma. This video was recorded during my postgraduate days, which you can see here. We are harvesting the blood. Blood is taken and drawn in a 10 ml syringe, and it is placed in a on EDTA vial and put in a centrifuge. Here it is mentioned at 2400 RPM. We obtain the snot clot here, and this is our product of interest. So a 10 cc of blood centrifuge for 10 minutes will provide an acellular plasma and the platelet-rich fibrin layer and the red blood cells layer. Over the course of time, we'll get a description of all these important and its application in ENT and head and neck surgeries. Coming to the applications in ENT and head and neck surgeries, I have used it for over 10 different conditions, and the results are there. And over time, we are following up these patients, and these are like the real game changers. And with time, we will come to know their importance. More studies are required, but at the same time, we should use it in the selective cases. And here are the cases where I have mentioned 10 different applications in ENT. I've tried it as an office procedure to heal tympanic membrane perforations in traumatic and even in chronic otitis media, where perforations are small to medium-sized perforations. It is also useful in type 1 medialization injection laryngoplasty along with fat, which will increase the duration of the medialization of the vocal cords. And it can also be used along with certain soft tissues and fat, and even with bone patties for mastod cavity obliteration, along with that platelet-rich fibrin adds an important role. It is also useful in the reconstruction of the posterior wall of the ear canal with the platelet-rich fibrin matrix and the cortical bone dust. The platelet-rich matrix can also be used as a fat plug, CSF rhinorrhea, and for also as a form platelet glue, which we can feel as a tissue glue for as a sealant for the assembly during the course of reconstruction of the skull base in CSF rhinorrhea. It is also useful in atrophic rhinitis patient. It can also be used as a packing material for middle ear surgeries, where we can use the fibrin part of the platelet-rich fibrin. The acellular fibrin can be used soaked with gel foam to pack in the middle ear and the extraocular canal. The platelet-rich plasma can also be used as an anti-aging material. It can be used amongst the dermatologists, and the platelet-rich plasma can also be used for treatment of androgenic alopecia. They use the ultra PRP nowadays. 2 or 3 sittings have shown results in selective patients in the initial phase of the alopecia. It can also be used for treatment of chronic pain in head and neck regions. So let's discuss individually the role of the platelet-rich plasma and the fibrin. Here I will describe an office procedure where we have used the traumatic tympanic membrane perforation and also for small perforation less than 4 millimeters. How can the platelet-rich fibrin work? So this is one case where we had a non-healed perforation, conductive hearing loss in the affected left ear, and we have used the platelet-rich fat plug, and this is after 1 month, and this is the completely healed tympanic membrane. So here you can see that this is a snot clot. You can also use it as a graft, and you can compress it and remove the blood clots. And here you can see you have the temporalis fascia kind of an appearance, but this is our platelet-rich fibrin in a crushed form. This can be placed as an underlay, overlay, or an interlay, and this will really help us in as a suitable scaffold in tympanoplasty surgeries. Here is a video description which you can see where we have used platelet-rich fibrin as a matrix, and we have used it for grafting. So in injection medialization laryngoplasty, we have used the platelet-rich fibrin for treatment of vocal cord paralysis, paresis, atrophy, scars, and sulcus. So here it acts as the lamina propria replacement. In mild to moderate defects and superficial injection, it corrects even the vibratory defects rather than the global augmentation. So it is similar to the type 1 medialization theraplasty, where a correction of temporary or permanent to mild to moderate glottal insufficiency less than 1 to 3 millimeter glottal gap cases. Here, injection materials, they vary in the specific viscoelastic properties and biocompatibility, which may affect the mucosal wave characteristics, that is the vocal fold vibrations, ultimately affecting the voice quality. So here we have a Storz injection syringe. Every click, it delivers 0.4 cc. There are different methods of delivering this injection medialization laryngoplasty, that is through cricothyroid membrane, through the thyroid cartilage, and directly to the direct laryngoscopy method, and also through flexible laryngoscopy method. So here we can see that there are certain cases where we have used fat along with PRF, and we have seen that it will also help in the augmentation of the vocal fold surgeries. So this is a pre-operative image, and this is the post-operative image. So we can see that in cases of type 1 medialization laryngoplasty, here we have seen that the PRF is obtained, and here we have harvested the fat from the abdomen or from the lateral aspect of the thigh. We centrifuge it, and we decant the less dense oil layer, and then release the dense aqueous component, and we transfer it into a small syringe, and we put it in a filter where we can prepare the fat. It can be microfat, nanofat, and it can be combined with the platelet-rich fibrin and also the platelet-rich plasma, which will also help in the injection laryngoplasty. So here we obtain the fat from the trocar, and the fat is aspirated and prepared, and later on the microfat preparation is obtained and stored in a 1 ml syringe for injections, and these are the necessary filters available. So this procedure can be done under local anesthesia and general anesthesia. So injection laryngoplasty with autologous fat and platelet-rich fibrin can also be used for these conditions. Here we can see there's a patient with a left side vocal cord palsy, and medialization type 1 medialization laryngoplasty is done, and this is the post-op result. So this is a video. You can see the procedure. This patient has a left side vocal cord palsy. The right side is compensating. This is the stroboscopic assessment. Also, there's features of chronic laryngitis in this patient. You can see that the left side vibratory folds are not so much prominent. And this is the pre-op image. And here the microfat is harvested and prepared. And after injection, this is how the appearance of the vocal cord in the left side is. And this is in the post-op phase. You can see from the video that there's a good closure of the glottic gap and the glottic chink. Next up is in the mastoid cavity obliteration. We can use the platelet-rich fibrin, compress it, and we can also use the cancellous bone or the outer cortex bone of the mastoid, and we can prepare a bony patty along with the platelet-rich fibrin, and this can be used as a mastoid cavity obliteration. So if we have an MRM cavity, here we can see that there's a facial ridge. We can also use to obliterate the cavity and creating it such a way that there was no cavity at all. Likewise, we can use the same to create a posterior wall of the ear canal with the help of the fascia, with the help of the PRF, that is the platelet-rich fibrin matrix, and you can use the cortical bone dust also to obliterate and also reconstruct the posterior wall of the extrontic canal. Here, the next up, we have its application in CSF rhinorrhea, and also how to prepare a tissue glue out of our own blood. So we have harvested the platelet-rich fibrin, and we have also used it. We can also add cancellous bone dust and prepare it to seal the defect in the CSF rhinorrhea in the cases where we can find the defect, and we can place it initial Surgicel. Then we can use the platelet-rich fibrin and fat also, and we can also use the fasciolata and the mucosa over it. So the platelet-rich fibrin acts faster with the help of the growth factor to seal the leaks along with the other layers mentioned. So this way we can also prepare our own tissue glue. Let me tell you how. The fibrin glue is actually a biological tissue adhesive which is based on the final stage of coagulation. Thrombin acts on fibrinogen, converting into fibrin. So here we take the 10 ml of patient's venous blood, and it is drawn preferably in a plain tube and or in a heparinized syringe, and it is centrifuged in 3000 RPM for 10 minutes. And the separated plasma is aspirated with a spinal needle. To this plasma, we add calcium, and calcium in the form of calcium chloride, 10%, and protamine sulfate. So from this, we can reconstitute and prepare our own tissue glue. This concept has been tried in all our cases where we have used tissue glue, and also we have compared with tissue seal, that is TCL, where we have customized companies where they prepare the tissue glues or the fibrin glues. Here, the initial steps are the same. Then the platelet-rich plasma concentrate is obtained, and calcium chloride is added to activate this solution, and protamine sulfate is added to create our own customized tissue glue, and the customized tissue glue here is ready to use. So here we have one patient where we have used tissue glue, and we have seen this is for a case of CSF rhinorrhea. You can see the Surgicel, and then we have started using the tissue glue later. So how does this work? We had done a prospective study where we have taken around 30 patients. 15 patients we have used the commercially available tissue glue, and the 15 patients we have used customized platelet-rich plasma tissue adhesive. We have found that both of these products available, one in the market and one customized, have equal long-term follow-up and equal results. Thus, the only benefit from this was we could reduce the cost, at the same time keeping it autologous and safe for the patient. So these are the certain images and the skull base repair, and here we have used the customized tissue glue. And here we can see the long-term follow-up results. Now, when we are coming to atrophic rhinitis, how does the platelet-rich plasma help? The injection of autologous platelet-rich plasma along with fat in the turbinates, the septum, the mucosa in the floor or in the lateral wall can help to stimulate the cells that are present, while fat can create a cellular rejuvenation and mucosal tissue regeneration. This entire nasal lining of the septum and the middle terminates could be injected with 5 cc syringe with a spinal needle of 22 gauge, and this can help in treatment of atrophic rhinitis. So this autologous fat can be an ideal filler for augmentation along with platelet-rich plasma and fibrin. This is a biocompatible, versatile, and a natural appearing, non-immunogenic, and at the same time inexpensive and readily obtainable with low donor site morbidity. Autologous fat typically lasts from a duration of 1 to several years. So these are certain images before, and these are certain images after. We can see an atrophic appearing turbinates, and later after the injection with fat and platelet-rich plasma, they literally even show secretions appearing at the end of treatment. This we have seen after initial injections, maybe can be repeated 1 or 2 times on OPD basis as well, or under general anesthesia as a part of the surgery. Next up, as I had mentioned, we can use the platelet-rich plasma as a packing material also in the middle ear surgeries, and also in the extranodal canal. And also, I have told that the autologous platelet-rich fibrin matrix can also be used as a graft material. Then there are the platelet-rich fibrin matrix as an anti-aging material. It can be used by the dermatologist and also by the facial plastics, those who have special interest in handling such patients, where certain fine wrinkles around the eyes, nasolabial grooves, wrinkles over the forehead, neck, and pregnancy and stretch marks, wrinkles over the lips, and acne marks, they have found the efficacy of platelet-rich fibrin matrix as a treatment for anti-aging. And also, next up, we have treatment for androgenic alopecia in selected subjects. The platelet-rich plasma and as this combination as a stem cell therapy, which has growth factors, stimulate the existing miniature hair to grow. So this acts by blocking the dihydrotestosterone and prevents the miniaturization of the hair follicles. And how does it differ from the hair transplant surgery? Transplanted hairs where the new DHT resistance hair follicles from the patient's head over certain time thins. So this can be given to improve the overall density with the extra hairs. So even a patient who has undergone transplant can also undergo the platelet-rich plasma and stem cell therapy to maintain the vitality of the already transplanted hairs and those who are also having androgenic alopecia. So the procedure involves the same: harvest, separate, activate, and inject. And then you see the hair follicles. The hair follicles load would have been better compared to the pre-procedure. It may take literally at least 2 or 3 sittings, and sometimes even more, maybe 4 or 5 sittings to get the results. So it is a valuable adjuvant treatment modality for patients with hair thinning, simple, cost-effective, feasible treatment option, and it has an excellent safety profile at relatively low cost. The last step is in chronic pain management in the areas of the head and neck region. So can be done under ultrasound guided ultra PRP, or PRP can be injected at the site of maximum pain. And if the BOC is positive with at least 80% in pain reduction, these patients are good, useful candidates for platelet-rich plasma. So we can take the plasma and we can give the block, and if there is pain reduction, and these patients are good candidates for treatment of platelet-rich plasma, where chronic pain in the head and neck region can be addressed. PRF by Chokran et al., they are actually the new second generation of the platelet concentrate. You can say that they are the autologous biologics. They are used to promote healing, bone regeneration, graft stabilization, wound healing, and hemostasis with bone morphogenetic protein. They are better organized and efficiently direct stem cell migration, and they help in the healing process. And it has been proven in vitro and in vivo studies. Dohan et al. Showed that these platelet-rich plasma and platelet-rich fibrin, they release certain growth factors which will help in cell migration, and it will also form a fibrin scaffold. The platelet-rich fibrin belongs to a new generation of platelet concentrates. This biologic activity of fibrin molecules is enough in itself to account for a significant cicatricial capacity of the platelet-rich fibrin. The slow polymerization mode confers a favorable physiological architecture to support the healing process. So my take-home message from this instructional course is an autologous platelet-rich fibrin is a simple, cost-effective, safe, and bioactive surgical material. And the several applications have been there in ENT and head and neck, and can be used as an office procedure too. The main aspect is proper harvesting of the platelet-rich plasma and the platelet-rich fibrin. This has to be done under a proper sterile surgical method. I started this procedure during my postgraduate days, and from there, I had started my presentation in autological cases and submitted it for the Dr. R.A.F. Cooper Award in our AOI-CON in 2017, I was awarded the RAF Cooper Award for this talk. The main preparation is correctly obtaining the platelet-rich plasma and the platelet-rich fibrin under the proper conditions. We can also use it in any place where there is a deficiency of tissues, loss of buccal mucosa, in oral submucous fibrosis, wherever there is any injury, and we can plug that area with platelet-rich fibrin, or the platelet-rich plasma can be used, and it will also help in healing in that particular site. And also it can be used for treatment of certain orthopedic issues, oromaxillofacial issues, and there are many a number of uses where even in gynec and OBG. But here we have focused and described in detail about the ENT aspects. There are more work happening in this, and more data are being gathered from multi-institutional studies, and they look promising. So the platelet-rich fibrin and the platelet-rich plasma depends on what you want and where you want to inject or where you want to place these agents. I hope from this instructional talk, you can go back and try these in your institution or in your private setup. All you need is a centrifuge apparatus, a sterile method of obtaining the blood and putting it in the harvest and putting in the centrifuge. Timing is very important. There's a soft spin. Maybe you can initially spin it for 2000 RPM or then later go for a hard spin 3000 RPM till you get those 3 layers. Once those 3 layers are obtained, you can remove only the plasma, use it for certain cases. Then you can take the fibrin, use it for certain cases. The concept of using it as a fibrin glue has been sent for patenting now, and this has been recently presented by me in the national conference in the Government of India funded conference on research and innovations, where this topic was awarded a first and second prize in paper and poster presentations, where they have found it as the platelet-rich plasma and the platelet-rich fibrin concept for treatment of CSF rhinorrhea and how to prepare a tissue glue at a very low cost. The commercially available ones are coming at a cost of 12,000 for 2 ml. I have prepared the same preparations for less than 500 rupees. This concept will be elaborated in details with time and presented in the national conference too, and in the respective state conference and many other scientific sessions. And these ideas can be shared amongst your colleagues as well. With proper care and preparations, we can customize to the dilution and the concentration of how much tissue glue is required and adequately use it for the surgery wherever there's a small defect or a large defect. It can literally cut down the cost as well as reduce the burden for the patient when it comes as a consumable. I hope this talk was informative. If at all there are any queries, any particular information you would like to know, you can get to me and write an email, and I would be happy to discuss and share my ideas with you. I would like to thank Microlabs, ENTrain team, Dr. Deepak Haldipur sir, Dr. Vishwas sir, for giving an opportunity to present my talk on applications of platelet-rich fibrin and plasma in ENT and head and neck surgeries. Thank you one and all for patient listening.